It is not about the World Health Organization doing that at a first stand, because it's a group of independent experts, the so-called emergency committee who met last week, up to 15 experts who evaluated the situation and then recommended the measures to the World Health Organization. And then, yes, the World Health Organization is to declare it. This emergency committee is ready to meet any time again as the situation develops. And they even said it last week in their statement that within 10 days, counting from last Thursday on, they think they will reconvene at the latest to reevaluate. So I think we're looking at a reevaluation very soon.
Christian, in terms of the importance of this evaluation, and I've just been doing a little bit of work on this one as well, you have been criticised previously, whether it would be the swine flu pandemic in 2009, the H1N1, and indeed your reaction to Ebola, both different reactions about when you declare that it is a global health emergency. Now, obviously, that's on the back of the committee, as you just explained to us as well. The important thing is not to get too exacerbated too quickly and spark panic buying of whatever it may well be, drugs, supplies and what have you, isn't it? The key is getting this right in terms of timing. You're absolutely right there. And let's not forget, we definitely have a crisis and an emergency in China right now. And as Professor Piet also explained, there is definitely something going on there. But declaring this a public health emergency of international concern is another step. It means that internationally this is spreading and is transmitting from human to human internationally. So not only a traveler carrying it from China into another country and being contained there, as we have seen so far, but spreading onwards there. And this is something we have not yet seen. Let's be very clear about this. We have seen many travelers, or not so many actually, if you count the population of China. We have seen a good number of countries receiving travelers from China, but onward spreading has not happened yet. It would not be surprising if it happened. Let me be very frank here. And this is why we need to closely monitor this. And health systems all around the world, the medical system has to be up to speed and be aware that this is what could come to their shores.
Christian, let me pick up on that point, because I note the comments from the Director General this morning, who approves of the Chinese government's measures to curb the coronavirus spread. So if we do see the spread into international markets, does that mean you would be advocating for governments to also lock down their countries or cities and perhaps move to cancel public gatherings, to look at the transport solutions and close schools? Would you be calling for that type of measure if we saw an outbreak like we've seen in China, in Wuhan?
So every individual state, every sovereign state has to do what it sees fit for their citizens, and they normally will do what they see best fit for the citizens. Recommendations by the World Health Organization normally never include travel and trade restrictions, because we have seen if we lock down a place, or we close borders, especially as we have seen in the DRC, for example, with Ebola, people will find alternate routes because they want to move. And then we cannot do the entry and exit checks anymore. So what is normally much more helpful is if we do entry checks at airports, fever measuring and checking the health of people. If at exit ports, at harbors, at train stations, we have something like temperature checks and general checks of the health of people coming from certain areas. That has proved much more helpful. And the reception or the detection of cases around the world, I think, has shown that the system is working pretty okay so far.
Just jumping in here, Christian, I'm just trying to work out what would be the benefit of declaring a global health emergency in terms of the level of global cooperation, for example, patient data sharing that would entail, and what the benefits would be in holding back from that. Do you feel that there would be a lot more global collaboration than there is today if indeed you made that official declaration, or would it not change that much?
A public health emergency of international concern, when it gets declared, very often triggers a political signal, as you very rightfully said. It shows the world leaders that international cooperation is now necessary in order to share patient data, but also to share the data of the virus, to encourage science, to put money aside, to encourage science, to work on vaccines, to work on medicines and treatments. This is what we don't have yet. I mean, we think that because it's related to the coronavirus, it was part of the coronavirus family. We know a good chunk about the virus, but yet it is a novel, a new virus, and there is not a treatment yet, and there is no vaccine yet. This needs to be encouraged. And let's not forget, a vaccine takes some time, so this is nothing we can knock out the ground immediately. This production alone takes between 6 and 9 months. So in the meantime, we have to find other solutions, including personal protection for people.
Hi, I'm Joanna Bersecci, and thank you for watching. You can check out more of our videos by clicking on the boxes on the screen. And don't forget to subscribe to our channel for more from CNBC International. Thank you for watching.